Vitamin D is essential for several reasons. Despite its name, vitamin D is not a vitamin, but a prohormone, or precursor of a hormone. Vitamins are nutrients that the body cannot create, and so a person must consume them in a diet. However, the body can produce vitamin D. The most common way people find out they are low in vitamin D is by doing a blood test. This is usually arranged by your health care professional if you have symptoms such as general aches or pains, your muscles feel weak, or you have a specific pain in your back, joint or bones. Some people feel generally tired and lethargic when their levels are low. They may notice changes in the shape of their hands or feet or knees. Children, especially if very low in vitamin D, can develop bone knees and a condition called rickets, the end result of severe vitamin D deficiency. In adults, this is called osteomalacia. It is therefore vital to get checked out should you have these problems. Enough of the introduction, let's get right into the 10 surprising health consequences of low vitamin D. 1. Cancer. Low levels vitamin D may be associated with different forms of cancer, such as pancreatic cancer and breast cancer. Low vitamin D was associated with a higher risk of developing prostate cancer. A small pilot study from the Medical University of South Carolina in Charleston found that when prostate cancer patients received 4,000 international units of vitamin D per day for 60 days, 60% of them showed improvement in their tumors. Also, some recent evidence has suggested a link between higher levels of vitamin D and a lowered risk of breast cancer. 2. Depression. A small studies found 3 women with moderate to severe depression experienced improvement in their symptoms after they received treatment for vitamin D deficiency. Another study published in Psychiatry Research in 2015 found that female college students who had low levels of vitamin D were more likely to have clinically significant symptoms of depression. 3. Asthma. Low blood levels of vitamin D have been linked to increased risk of asthma attacks in children and adults with asthma. Research found that giving an oral vitamin D supplement reduced the risk of severe asthma attacks requiring hospital admission or emergency department attendance from 6% to around 3%. They also found that vitamin D supplementation reduced the rate of asthma attacks needing treatment with steroid tablets. According to a large Israeli study published in Allergy that tracked more than 21,000 adults with asthma, while people with asthma were no more likely to have low D than those in the general population, asthmatics who did have a vitamin D deficiency were 25% more likely to experience acute attacks and to need to see a doctor more frequently for their asthma. 4. Heart disease. Heart disease and vitamin D deficiency are known to go hand in hand, and has received widespread attention for its potential role in preventing cardiovascular disease. A growing number of studies point to vitamin D deficiency individuals as a risk factor for heart attacks, congestive heart failure, strokes, and the conditions associated with cardiovascular disease, such as high blood pressure. Subjects with extremely low levels of vitamin D were nearly 3 times as likely to die of heart failure and 5 times as likely to die of sudden cardiac death. 5. Tooth loss and gum disease. Vitamin D is crucial both to our dental health and the formation of our teeth in the first place. Sufficient vitamin D levels can potentially decrease inflammation and affect oral microbes related to gum disease. Aside from vitamin D's role in fighting infections and reducing inflammation, some research has shown that vitamin D receptors are directly associated with periodontitis, a severe gum infection that can lead to tooth loss and other serious health complications. Sunshine vitamin has a key role in protecting our teeth as we age too. Low levels of vitamin D also causes tooth decay in infants and toddlers. Research found that mothers of children with weak enamel and tooth decay had significantly lower vitamin D levels during pregnancy compared to moms of children with healthy teeth. 6. Mental disorders, also known as schizophrenia. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning, and can be disabling. There's a strong link between vitamin D deficiency and this mental health disorder. Research found that 65% of schizophrenia patients had low levels of vitamin D, and people with vitamin D deficiency were more than twice as likely to have schizophrenia. 7. Eczema. Studies have indicated a link between vitamin D status and eczema outcomes, including lower vitamin D levels associated with increased incidence and severity of eczema symptoms. Study found that Norwegian kids with eczema who were taken to a sun-drenched subtropical island for 4 weeks experienced relief from their symptoms that lasted for 3 months after they got back home. 8. Osteoporosis. Our bodies rely on vitamin D to help absorb calcium and grow bones that stay dense and strong throughout our lives. Osteoporosis causes a loss of bone density, such that the bones to become weak and brittle, so brittle that a fall or even mild stresses such as bending over or coughing can cause a fracture. Osteoporosis-related fractures most commonly occur in the hip, wrist or spine. More than 50% of women treated for bone loss have inadequate vitamin D levels. In fact, the National Osteoporosis Foundation recommends 400 to 800 international units of vitamin D per day for adults under the age of 50, and 800 to 1,000 international units for those over the age of 50. 9. Alopecia or hair loss. Although it is controversial, vitamin D deficiency has been associated with various forms of non-scarring hair loss. Vitamin D is vital for hair cycling, and helps push hair from its resting phase to the growing phase. It plays a crucial role in stimulating new and old hair follicles. When there isn't enough vitamin D in your system, new hair growth can be stunted. A study showed that women with female pattern hair loss had significantly lower levels of vitamin D than those without hair loss. 10. Breast cancer. Research suggests that women with low levels of vitamin D have a higher risk of breast cancer. Vitamin D may play a role in controlling normal breast cell growth and may be able to stop breast cancer cells from growing. Vitamin D influences breast cancer development and progression in important ways, but the relationship is not fully understood. Vitamin D influences the expression of breast cancer-related gene activity, including cell differentiation, cell growth, and angiogenesis, all of which are related to cancer development and progression. Though the relationship is not fully understood and is still undergoing expert study. Having said all, though not getting enough vitamin D can lead to negative health consequences. The good news is, it's relatively easy to get enough vitamin D. Certain foods, including fatty fish, can help you increase your levels, as can sunlight. Specifically, 15 minutes of sunlight in your hands and face each day can do the trick. You should check out our other video, 5 or more foods that are high in vitamin D that increases your vitamin D level. For more health tips, facts and life hacks, check out our other videos in the description. Also kindly like, subscribe and share.